Hi there, I'm Sharon Martin. This is going to be a quick and impromptu video just to talk a little bit about codependency and the way that maybe you're experiencing some different or extra struggles around codependency and boundaries, given what's happening with the coronavirus outbreak and needing to stay home and just a lot of changes to our normal routines and life in general at this point. I've heard from a number of people who have talked about some new struggles around boundaries that they've had, and certainly one of those struggles can be in trying to have enough physical distance from strangers or just people when we go outside of the house. You need to keep that social distance there, and then we also have some struggles with potentially being home, spending a lot more time around people who push on our boundaries or don't respect boundaries. And that can be, of course, very difficult as well. You may feel a bit stuck in not being able to, you may not have some of the choices that you had before in terms of getting some space there, both physical space or emotional space, away from somebody who's being unkind or hurtful or difficult, disrespectful, any of those kinds of things. And then the other kind of boundary struggle that I've heard from people is that they're feeling pressured from people outside of their immediate family to do things that maybe they were able to do for them before, whether it's go and visit somebody or watch their kids for them, just various activities that they might have done outside the home. That now they feel like are not, it's not prudent or it's not safe for them to do anymore, and somebody is not being understanding or respectful of that limit that they're trying to set. So all of these can be difficult in their own way. And one thing that we really want to remember about setting boundaries is that the purpose of setting the boundary is to take care of yourself. It is to, especially in these times, it's often to protect our own physical health in ways that we've really never had to deal with before, for most of us anyway. But, being able to stay away from people, not because we don't want to be around them or we don't want to help them, but simply because it's best for our own health, but really beyond that it's important for the community and the health of, others around us, our more vulnerable community members, our doctors, nurses, police officers, firefighters, grocery store clerks, all the people that we clearly need and depend on for things to keep running. One thing I want you to really keep in mind, if you're experiencing any of these struggles, is self-care is essential. Whenever you are experiencing something that is difficult or stressful, that means you need more self-care. You need to take extra good care of yourself, again, your physical health, but also your mental health. You may want to, try to be creative and look for ways so that you can be good to yourself, say nice things to yourself, treat yourself with that loving kindness. It may be, trying to take a little bit of extra time to take a nice hot bath or shower that's both relaxing, but it maybe gives you a little space from somebody who's difficult in your household as well, or trying to get out and do some more walks around the block. Again, obviously good for our health, but also can potentially give us a little bit of distance, some time to ourselves that can be really helpful as well. I think in some of these situations with the boundary challenges, they really call for us to be more assertive and to just directly but kindly tell people what it is that we need or what we can't do or what we can do at this point. And this doesn't require us to give a long explanation of why we're making the choice that we are. We're all entitled, to make the choices that feel like they're the right things for us. That being said, I do think in some situations it can be helpful to try to just, in a general sense, let somebody know that, the reason that you can't do something is because that's the recommendation of, the public health department or a medical expert. that can just help somebody feel like it's a little bit less personal, if that's the way that they were taking it, as if you were, um, not wanting to see them in particular, or not being helpful in babysitting their kids anymore. But it's not; those are not the reasons. It's just simply it's not advisable, given the current situation that we're in, and we're going to, you can just simply say, I'm going to be following the advice of the public health experts, or the medical experts. And sometimes that can be helpful, just so that, it's not just you saying it. It's sort of like you've got this, experts behind you, saying this as well. Um, so, I mean, those are a couple of different struggles that may be coming up, for you. I think, the other piece is that, you may be feeling guilty about not being able to do some of the things that you used to be able to do. And again, part of the way to sort of unwind some of that guilt is to remember that the guilt is a feeling that we have when we think that we're doing something wrong. And sometimes it's helpful to just simply ask yourself, is there really something wrong with what I'm doing? Um, Hopefully the answer is clear that there's not. But the other thing that you can ask yourself is, who is deciding whether there's something wrong about what you're doing, right? Is this really that you are truly feeling like there's something wrong, or is it that somebody else is telling you that there's something wrong, or they're trying to make you feel bad as if you were doing something wrong, almost as a manipulation to get you to do what they want you to do? Um, again, sometimes that can be pretty clear once you start, looking into it a little bit, asking yourself some of those questions that you can, clearly say, actually, this is the best thing for me to do at this point. And then we have to be able to tolerate the fact that, some people are not going to agree. They're going to, be unhappy with the choices that we're making. And again, I mean, this is, something that we run up against, all the time when we set boundaries, or when we, do things to take care of ourselves. Is some people don't like it. And this is absolutely, a situation where we need to work on talking to ourselves, in terms of, this is an okay thing for me to do. This is a healthy thing for me to do. This is something that's good for me. And being able to also have that talk with ourselves that, I can tolerate it if other people don't like it. It can be uncomfortable. I wish that they saw things the same way that I did, but I can't force them to. Um, and that's that part of sort of letting go and saying, you know what, they're, entitled to their own feelings and their own thoughts and their own choices, just as you are. And the most important thing is that we try to feel good about the choices that we're making, despite what other people think of those. And of course, I mean, that can be tough. I absolutely, understand that it's difficult, and it's extra difficult, when we just consider how much additional, stress and worry and anxiety most of us are feeling at this point. Which again is just, a reminder to keep circling back to that place of saying, okay, this is tough right now. That's understandable. What is it that I need to take care of myself? How can I help myself cope? How can I help myself get through this? And really, by doing that, you end up helping everybody around you as well. Because when you're at your best, physical health, mental health, you're feeling good, you have energy, you're in, better spirits. That's better for everybody, that you come in contact, in person or online, that, you might be talking to. So make sure that you are taking really good care of yourself. Be patient with yourself, and, know that these are, tough times, but they aren't going to last forever. I absolutely hope that you are, staying healthy, and, your loved ones are as well. If you have some additional questions, specifically about boundaries or codependency, related to our current, coronavirus, situation, feel free to put them in the comments, and I'll try to answer them for you, or put them into a different, video, or something, along those lines. But thanks for watching, and, best wishes, and take care. Bye bye.